what do we do for PVCs actually? How can we evaluate, when you have PVC? We can put in a monitor. Event monitor is like this small sticker you can see here on the picture. It can keep recording your heartbeat at home. And whenever you have symptoms, there's a small button there you can press and we can go through that recording. We also analyze your heart function by doing an echocardiogram, which is ultrasound of your heart, or an MRI of your heart. And PVCs or extra beats can be safely and effectively treated with a procedure called radiofrequency ablation, which is a small, minimally invasive surgery that can correct or take care of these extra beats. Sometimes we can give you medicine to suppress these extra beats, depending on your preference. So if you feel that you want to get rid of this problem and you don't mind going for a procedure, it can be safely done with very good efficacy. The second arrhythmia I'm going to talk about, which can cause palpitation and is very common, is called atrial fibrillation. So you just saw a normal beating heart. I showed you the animation a while ago, but here you can see the heartbeat is very chaotic, very disorganized. And heart is, instead of contracting, it's actually quivering, like shaking only. That is why it is called atrial fibrillation. And in atrial fibrillation, your actually rhythm, instead of coming from your natural pacemaker sinus node here, it starts from the left chamber. And as you can see, the electric current in your heart runs in a very disorganized way. So this very disorganized kind of heartbeat, actually you feel that your heartbeat is all over the place. You feel that your heart palpitation is feeling like your heartbeat is fast, but not regular. And as I showed you earlier, you can see that actually the current comes from this side and it travels to all over your atrium. And that is why your bottom chamber heartbeat is also very irregular and chaotic. Atrial fibrillation is one of the most common heart rhythm problems worldwide. And if you look at Indonesia and Singapore, you can see almost prevalence-wise. Prevalence means the number of patients at any point of time. And this data is from 2010. For every 100,000 patients, there is about 400 to 500 AF patients in the population. So, and this may be underestimation, because if you look at US data, the prevalence is much higher, almost 700 to 770 patients per 100,000 of population at any point of time have atrial fibrillation. So just as I mentioned, our region, Indonesia and Singapore, the prevalence is about 400 to 475 per 100,000 population. So who is at risk of developing or having atrial fibrillation? Advanced age is a risk factor. That means the older you are, the higher chances of having atrial fibrillation. High blood pressure is one of the reasons to get atrial fibrillation. Diabetes, obesity or overweight. People who have underlying heart problem like valve disease or previous heart attack or heart failure are also more prone to develop atrial fibrillation. Patients who have obstructive sleep apnea. That means their sleep is disturbed, they snore a lot during sleep, and they stop breathing during their sleep, sometimes are at high risk of getting atrial fibrillation. Having a family member with AF increases your chances of atrial fibrillation. Excessive alcohol intake can predispose you to atrial fibrillation. Certain medical problems like thyroid problem, asthma, or lung problems can also predispose you to atrial fibrillation or AF. And what exactly you feel when you go into AF? You feel your heartbeat is very rapid. You can feel fluttering or pounding in your chest. And this sensation can be present in your neck as well. And as I mentioned earlier, you might feel that your heartbeat is all over the place. You might feel tired, fatigued. Sometimes it is associated with chest pain, difficulty breathing, or easily getting tired or short of breath with activity, lightheadedness or dizziness. Sweating means cold sweats, of fainting or loss of consciousness or near fainting.
Terima kasih telah menyaksikan video ini dan jangan lewatkan video menarik lainnya dari channel Tkon TV. Sampai jumpa di video selanjutnya. Stay healthy with Tkon TV.